Continuing on with patient assessment, we also want to be able to know your animal's normal body temperature. So unfortunately the way we have to take temperatures, we have to do it rectally, so I won't demonstrate because Rusty I'm sure wouldn't appreciate it, but in the case you have to do it, always, a digital thermometer is always the most useful thing, I think. And I've tried, going back to taking the temperature, I've tried the ear thermometers, and due to the variation in the pigment in animals' ears, they aren't always accurate. And I've actually compared them to rectal temperatures, and there's not a good one out there. So unfortunately, we have to do a normal digital one. And always use KY jelly if you have it available, Vaseline, just so you don't damage tissue going into the rectum, because that's don't want to cause more problems than you're trying to fix. If you don't have any lube with you, the cheapest way to do it is just spit on the thermometer. I know that does work pretty well as well. So, so temperature. So we talked about normals. 99.5 to 102.5 is the normal. Usually anything above that or below that, there can be different scenarios that are causing it. So a lot of things we associate with high body temperature. It can be an indication of heat stroke. Animals do get heat stroke, and we'll talk about that later. Can be an indication of infection. Also, animals that have cancer can sometimes have temperature rises that are unexplained. So, those are kind of the three commons we see. Decreased body temperature. This can be associated with, just simple exposure and being outside, especially in the wintertime, especially with small dogs. We want to kind of avoid putting small dogs outside for extended periods in the wintertime. Also can be associated with illness. Low body temperature is an indication the body is shutting down, and the metabolic processes that usually keep body temperature up are no longer functioning. And then, also just maybe your animal has a low normal body temperature. Just keep those in mind. Other assessments, we look at are dehydration. Some things that can cause dehydration are, excessive vomiting, diarrhea, kidney failure. We see that a lot in cats, especially, and diabetic animals that urinate more frequently than normal can be dehydrated. So the way we assess hydration status is just, first of all, look at the third eyelid, and that's, you'll see that, and you can't see it in Rusty because he's hydrated well, but you will actually see a little flap of skin going over the eye, and that's because the eyes actually sink back in the animal's head, and that's why the third eyelid comes out and becomes more prominent. Other ways to assess, we go back to the mucous membranes. If they're tacky, that's an indication if they're tacky or dry. Also, skin tenting, that's another useful way to look. If you pinch the skin and it stays up, that means they're dehydrated. It should be normal, elastic, and bounce back right away, and that's just some good ways to assess.